Welcome back to TV5 News at 9. Joining us this morning is Dr. Brian Ye. Thank you so much for being here, Doctor. How are you?
I'm doing well. How are you?
I'm doing great. I'm so glad to have you back here. We are talking about colorectal cancer. Now, doctor, there's a certain age that people should start having colonoscopies, but sometimes a colorectal cancer diagnosis can come at a younger age. So what are the recommended guidelines?
So for people who are at average risk for colorectal cancer, the current recommended age to start screening for colorectal cancer is actually 45. They just changed this last year. It used to be 50. So everyone who's 45 or older should be screened for colorectal cancer. Now, there are some people who are at increased risk for colorectal cancer. These include people who have a family history of colorectal cancer, or they have certain genetic syndromes, or, for example, African-American people also have an increased risk of colorectal cancer. And these people can start screening for colorectal cancer at the age of 40 or even younger. They should speak to their physician about when they should start screening for colorectal cancer.
Okay, that's great information there, those guidelines. Now, doctor, what is proton therapy and what are the benefits of proton therapy for colorectal cancer patients?
Proton therapy is a more focused form of radiation therapy. X-rays go through the body, and protons, they're sort of like a marble traveling in water. So, for example, if this is the tumor, protons would come in and they slow down like a marble and eventually stop. They don't go out the other end. So protons don't have something called exit dose. So protons are more focused, there are fewer side effects, and they're as effective as X-ray therapy for curing or controlling cancer. Now, some patients with colorectal cancer will require radiation therapy, not all. For example, patients with rectal cancer typically do get radiation therapy. And actually, with proton therapy, we're actually better able to spare normal tissue. There's less radiation dose to normal organs, and yet we can still get the same amount of radiation dose to the tumor. So this year's a slide. It's actually 3 X-ray plans. So this one labeled 3D, CRT, also IMRT, and rapid arc. These are 3 different types of X-ray therapies. Then there's one on the bottom right called protons. And this is called what we call a dose wash. What it means is basically there's a color to how much radiation dose is being delivered to different parts of the body. And so blue is a lower dose, red is a higher dose. You can see here there's a rectal tumor sort of in the middle, but I'm treating more than just a rectal tumor. Outlined in red are all the lymph node areas that I need to treat as well, because the cancer can spread to the lymph node areas. And you can see here, we want to treat this area with the highest dose of radiation, which is in red. With X-rays, you can see here, either with the 3D CRT or the IMRT or the rapid arc, the normal body, all the tissue surrounding that sort of red outlined area, gets a lot of radiation dose. You can see here in the bottom right, with protons, we're able to focus that radiation just where it needs to go, and there's very, very little other normal tissue that gets exposed to radiation. So proton therapy is a safer form of radiation therapy with fewer side effects.
Wow, and you can really see how that targeted therapy works with that slide. Thank you for that. Now, Dr. Ye, how can people find out if proton therapy is the best treatment for them?
The best way is to call the McLaren Proton Therapy Center at 855-MY-PROTON, that's spelled MY-PROTON, or they can visit our website at mclaren.org/proton treatment.
Anything else, Dr. Ye, that you wanted to share with viewers about proton therapy or colorectal cancer?
Well, just to let people know that proton therapy is an effective treatment for colorectal cancer. If they have any questions, they should give us a call.
I love it. Well, thank you so much for sharing this information with us today. We appreciate you.
Thank you very much for having me.
Of course, you're welcome. And you can find more information in the hot link section at WNEM.com.